Am I visible to you all? Yeah, perfect. So, we'll be starting with the today's session. So, I am Dr. Kapil Singhal. I'll be discussing today dental implants, the basic of dental implants. This year also we got some of the questions from implants, and it's an important topic and a topic that we generally don't study in our graduation days. So I'll be covering up all about implants in 2 or 3 sessions. So we'll make sure you should be able to solve all kind of MCQs that come regarding implants. Okay. So first of all, what is the rationale of implants? Why do you need an implant? See what happens once the tooth is extracted. Do you see this bone? This bone is known as bundle bone. The bone around that socket is known as a bundle bone. Now once that tooth is lost, this bundle bone starts resorbing and the placement of the implant with time becomes difficult. So it is important that as the tooth is extracted, the implant should be done at the same time to prevent loss of this bundle bone. So that's the bundle bone marked in black. Okay, so once this tooth is extracted, and if the bone, the socket is not replaced with an implant, this bone will remodel to this bone, what you can see here in the arrow, and the bone will resorb significantly. That placement of implant will require a lot of bone grafting. So if they ask you a question that if you extract a tooth and replace with an implant, you can decrease the bone remodeling. You can decrease the loss of bundle bone. Okay. Now, next thing that you need to understand, what are the different components that are required for dental implants. First of all, we all know that your implant is a hollow structure. So this is your implant. It is made up of titanium, and this implant would be covered with a screw that is known as a cover screw. So next component that you need to remember is this cover screw. One sec. Okay, so that is this cover screw. So what happens when you place this implant? This implant is hollow from inside. Now, when you place this implant, if you don't cover this implant with something, that's your cover screw. So what will happen? The food and the saliva and the blood can assemble inside this implant and create an environment for the biofilm to form. Now, to prevent this biofilm from forming, you need to cover this area with a cover screw. So what is the role of the cover screw? During the time when the implant is osseointegrating with the bone, it prevents the formation of a biofilm inside the implant by preventing blood, saliva and food particles from going inside. Okay. So next, this is a cover screw. So if they give you a picture like this and ask what is this, this is a cover screw. Now if you see here, this picture number A, the implant is placed in the bone. Then you hold this cover screw with the hex driver and place this cover screw over the implant, and then you torque it with this hex driver so that this cover screw is placed over the implant. Now once this cover screw is placed over the implant, you will suture the tissue over it so that the food particles and saliva would not impact it. Okay, so it means you have sutured it. Now what will happen? After 7 days you will cut the sutures and your site will be completely healed. Now after 3 months, when you will call the patient again, you will give anesthesia to the patient. Give an incision again. Now we'll move it in the reverse manner. So after 3 months, I'll give an incision, reflect the flap. I can see my implant has osseointegrated with the bone. I will take the hex driver. So this is a hex driver. So they may ask you one question: what is a hex driver? So if you want to tighten any component over the implant, maybe it's a cover screw, or now we'll study about the different other components. If you want to tighten any component over your implant, the driver that you require is known as a hex driver. So basically your hex driver is like a screwdriver that will help to tighten your implant or your components over your implant. So what we have done is, now we have taken that hex driver, we have unscrewed the cover screw. Now this is that implant that has osseointegrated with the bone. Now I need to place another component over my implant, so that my soft tissue would not cover it, and it will lead to formation of a soft tissue emergence around my implant. So next component that you will require, so patient will come to you after 3 months and we'll take one X-ray to see if your implant is integrated. This is the hex driver. So they can give you this picture and ask, what is this? This is a hex driver. So this driver is used to tighten all the components over your implant. Okay. So that is the cover screw, and now you will require a healing cap. So once my implant is integrated, I have removed the cover screw. Now I will place my healing cap over the implant and I will suture. So I'll place my healing cap over the implant and I will suture. So this is known as a healing cap or a healing abutment or a gingival former. Why it is known as gingival former? Because it helps to form the shape, the emergence of gingiva around the implant. So this is the role of a healing cap, to form an emergence of soft tissue around the implant. So this healing cap has helped to create an emergence of soft tissue around the implant. Okay. So once this soft tissue emergence is created around your implant by the healing cap, so I can ask you a question, which component helps to get this emergence? So the option could be healing cap or a healing abutment or a gingival form. Now my implant is ready for the next step, that is impression. Okay, so that is the emergence, that is all created by the healing abutment or the healing cap. Okay, so that's the healing cap. So these are healing caps that when they are placed, it helps to create an emergence of the soft tissue around the implant. So once this emergence is created, now the next step is to make an impression. Now for implants, if you want to make an impression, there are two techniques of impression making. One is open tray technique and the second technique is the closed tray technique. The second technique is the closed tray technique, open tray and closed tray technique. Now what are these techniques? So obviously if there are two impression techniques, you will require two types of impression post. One is open tray impression post and the second is closed tray impression post. Okay, open tray impression post and a closed tray impression post. Now this open tray, as the name suggests, you will require a tray that has an opening. So that is why this is known as open tray impression post. Now what is this open tray impression post? So what I will do is, you will remove those healing cap, you will put the open tray impression post over your implant, you will tighten them with the hex driver. Now I will select a tray. So these are open tray impression post we have placed over the implant. Now I will take, so this is the healing cap. We have removed the healing cap. Now the tissue has healed. I have a soft tissue emergence around my implant. This is an open tray impression post. So if you get a picture like this and they ask you what is this, so that's an open tray impression post. Now I will select a tray and I'll create an opening. That is why open tray. I'll create an opening in this tray. So that's an opening I have created in the tray. I will put light body. You need an adhesion silicone for making an implant impression. You cannot make an implant impression with a C silicone. So I will put light body around the impression post and I'll put putty in my tray and I'll insert that tray in the patient's mouth. when the impression material is hard and rigid. See, during the full duration, you should be able to visualize this screw head. ये screw head आपको दिखते रहना चाहिए. Now, once this material is set, I would not remove the tray. What I'll do is, I'll take a hex driver and I'll start unscrewing this screw. ये जो screw दिख रहा है, I'll unscrew this screw. And I'll unscrew this screw, and now when I will remove the tray, that impression post will be picked up. That impression post will be picked up in the impression on its own. I don't have to manually push it. वो अपने आप automatically it will be picked up inside the impression. So that is why this open tray impression technique is also known as pickup impression technique. This open tray impression technique is also known as a pick up impression technique. Okay, so that's a open tray technique. Now the last technique, let me just go back. So that was the first technique. The second technique was the closed tray. So we'll come to closed tray technique now. In a closed tray technique, I will use this closed tray impression post. So as the name suggests, I need a tray that does not have any opening. So I can take a normal stock tray or a plastic tray that does not have any hole. So what I'll do is, I will remove the healing cap. Okay, I will put this open tray impression, this closed tray impression post over my implant. I will choose a tray with no opening. I will put light body around my impression post, okay, and I'll take a putty inside the tray and I'll insert that tray in the patient's mouth. जैसे ही material set होगा, I will remove the tray, but the impression post is still in patient's mouth. तो closed tray में the impression post is still in patient's mouth. Now I will unscrew that closed tray impression coping. I'll unscrew this closed tray impression coping and I will manually transfer this impression coping inside this impression. So I will manually transfer my impression coping, my closed tray impression coping in the impression. So that is why closed tray impression technique is also known as a transfer, because you are manually transfer that impression coping in that impression. So a closed tray impression technique is also known as a transfer impression technique, and the open tray technique was known as a pickup impression technique. So what do you think, which is more accurate, an open tray or a closed tray? Which is more accurate? What do you think, which is more accurate? So as in open tray, you don't have to actually in open tray you don't have to manually transfer. There's automatically that your impression post is picked up. So that is why your open tray impression technique is more accurate as compared to your closed tray. Not closed tray, open tray. So please remember, open tray is more accurate as compared to closed tray. So wherever possible, you should always prefer to take an open tray impression. Closed tray should only be preferred. So what are the indications for closed tray? Closed tray should only be preferred when the mouth opening is less. Number one, the mouth opening is less. And number two, it can still be done for single implant cases. But अगर क्वेश्चन आता है single implant cases में भी preferred technique, answer is open tray. But single implant cases में, if you want, you can still do a closed tray. But multiple implant cases में, multiple adjacent implant cases में, open tray technique is more preferred as compared to closed tray. So the only indication for closed tray ideally is when the mouth opening is less. Otherwise, open tray technique is a more preferred technique. Is it clear? Is it clear to everyone? So these are the two impression techniques. Now, a lot of time, See, there is one more technique in impression that is known as splinting of impression post. So a lot of time what happens, there are multiple adjacent implants. There are multiple adjacent implants. Now, when you want to make an impression in such cases, it is mandatory that you splint the adjacent impression post. So now what is splinting? Now see, whenever there are more than one adjacent implant, could be two, could be three, could be four, or could be a full mouth case. When there are more than one adjacent implant, it is important that you splint these impression posts with a material that is known as a pattern resin. So this material, that red color material, is known as a pattern resin. So you can get this picture. They can ask you multiple questions on this. They can ask you, what is this? So this is a pattern resin. Now they can ask you why the pattern resin is used, so that all the impression posts are splinted together and they don't move during the impression, so that the impression is rigidly taken and there is no error in your impression. Now they can ask you why only a pattern resin is used, why not a cold cure or a composite is used. So please remember, because in a pattern resin there is no polymerization shrinkage. So that is why a pattern resin is preferred as compared to a cold cure or as compared to other materials like composite. Pattern resin has no polymerization shrinkage. If you don't splint your adjacent implants, there would be always activeness in your prosthesis. What do you mean by activeness? It means when you will try to push that prosthesis over your implant, वो freely नहीं जाएगा. It would always have some interferences. So these interferences means the prosthesis is active. An active prosthesis is not good. So what is this? अगर ये picture मिलती है, this is splinting of the impression post done with a pattern resin. Okay, so that's a pattern resin. It comes in same like cold cure powder and liquid. You need to mix it and then apply it over the impression post. So that's a pattern resin that is used to splint the impression post. So whenever there is more than one adjacent implant, you need to make sure you are splinting your impression post. The next component is a lab analog. Now what is a lab analog? So basically, see what happens. Basically, a lab analog is your implant replica. See, when you place your implants and when you made an impression, अब आपने क्या करा, impression लेके patient को तो healing cap लगा के घर भेज दिया, and you are left with just with an impression. You don't have any other thing. Now to make a prosthesis, you need a working model. So basically, what is a lab analog? This is the replica of the implant, the copy of the implant. Basically, it is implant for the lab technician. Now, what your lab technician will do, he'll take this lab analog, he'll place it over the impression post, and he will pour the model. So this is just to show you, I have sectioned a model. So this lab analog, which is an implant replica, a copy of the implant, will come into the model exactly in the same place and same angulation where the implant is in patient's mouth. Okay, so basically your lab analog is a replica of the implant. It comes into the model and works like an implant for the lab technician so that he can fabricate a prosthesis over it. So basically you'll have a working model like this. So you'll have a model like this. Now the next step is the fabrication of the prosthesis. So next क्या करना है आपके लैब वाले को? Prosthesis बनाना. To fabricate a prosthesis, you need to send the next component to the lab, that is known as an abutment. So basically your abutment is a small component. It's a small component that connects your crown to the implant. What is an abutment? It is a small component that will connect your implant with the crown. Now there are different kinds of abutment. The first kind of abutment that is visible in front of you are made up of titanium. They are made up of metal. Which metal? Titanium. So anything in dentistry that is metal is known as stock. So these abutments are known as stock abutments. So whenever someone says stock abutments, it means he's talking about the metal abutments. They could be straight or they could be angled. They could be straight or they could be angled. Suppose you have placed an implant and there's some angulation in your implant. To compensate that angulation on your implant, you may need to use an angled abutment. ऐसे this in एक question और आता है, what is the maximum permissible angle of the abutment that is allowed? The answer is 25 degrees. What is the maximum permissible angle of the implant that is allowed? 25 degrees. So a lot of time, like when you place an implant in maxillary anteriors, the bone itself has an inclination of 12 degrees. So even if you're placing your implant straight in the bone in maxillary anteriors, to compensate the angulation of the bone, you may have to use an angled abutment. So straight and angled abutments are two different abutments that you may have to use. So if you get a question, what are these? These are stock abutments, straight and angled. What is this? If you get a picture like this, that is basically a abutment. This is plastic, so it is known as a plastic abutment. What is this? It is known as a plastic abutment, also known as a UCLA abutment. They may ask you a question. What is this? This is a UCLA. It was found in University of California. This का नाम क्या पड़ गया? UCLA. Or a plastic abutment, or a castable abutment, or a castable abutment. Is it clear? अब इसमें देख रहे हैं ये पार्ट पूरा प्लास्टिक का है. So just remember one thing. There are two kinds of abutment that we have discussed. One is stock abutment made up of metal. So जब भी मुझे प्रोस्थेसिस सीमेंट रिटेन्ड बनाना है, सीमेंट रिटेन का मतलब मेरा क्राउन आएगा और इस अबटमेंट के ऊपर सीमेंट हो जाएगा. सो व्हेनेवर आई हैव टू मेक अ सीमेंट रिटेन्ड प्रोस्थेसिस, I will always use a stock abutment. I will always use a stock abutment. Whenever I have to make the second kind of prosthesis, that is a screw retained prosthesis. Whenever I have to make a screw retained prosthesis, the abutment that I will utilize is basically a UCLA abutment or a plastic abutment. So this abutment is used to make a screw retained prosthesis. Okay, now see in your abutment, what you can see here, there is a hex. Can you see this is a hex? And this is non-hex. So your abutment can be hex or your abutment can be non-hex. Now it's a very important question. वो पूछ सकता है आपसे, in which condition you will use a hex abutment and in which condition you will use a non-hex abutment. First of all, it is important for you to just by seeing the picture to recognize which is hex and which is non-hex. Okay. So hex कब use करना है? When it is a single implant, single crown. Single implant, single crown. मतलब suppose you place an implant in a first molar, lower first molar, and you have to make a single crown. So one single implant, single crown, always your abutment would be hex. But when there is more than one adjacent implant and you have to make a splinted prosthesis, means a prosthesis would be joined. So आपका abutment हमेशा क्या होगा? Non-hex. So just remember two things. When it is a single implant crown, it would be always hex in your abutment. Whenever there are multiple connected implant crowns, means suppose you have placed an implant in 6. If it is a single implant, single crown, you will always use hex in the abutment because these hex are anti-rotational feature and it helps to prevent any screw loosenings. Okay, so that is why when it is a single implant, single crown, it should always be hex in your abutment. When there are more than one multiple adjacent implant, then it should be non-hex. Okay, like as we have discussed, you have 6 or 7 as 2 adjacent implants, then the abutments that I'll use would be non-hex. Okay. Am I visible and audible? Yeah. Okay. Now, so basically that's an abutment. First, this abutment is screwed with a screw over the implant, and that crown would be cemented over it. Okay. So now we have understood that there are two types of abutment and there are two types of prosthesis. One is cemented and the second is screw retained prosthesis. So when you want to make a cemented prosthesis, you will use a stock abutment, maybe a straight or an angled. But when you want to make a screw retained prosthesis, in a screw retained prosthesis, the prosthesis is tightened just with the help of the screw. So in case of a screw retained prosthesis, you require an UCLA abutment. Okay, so that is the hex driver that will help you to tighten all these components over your implant. Is it clear? So these were all the components that were to be used for implants. Okay, so I would ask you just go through this portion of that implants today. Next time I'll be discussing about the different kinds of implant surgery, the protocols of drilling, okay, and important anatomical structures. So that would be the part 2 we'll be taking in the next YouTube section. Okay, thank you so much for today. That is all for today, and we'll be discussing the next part in the next session.